everyone, my name is Elise Nguyen, and I am one of the high school leaders for ABCs for Global Health Summer Global Health Immersion program. So for some quick background on ABCs for Global Health, it is a nonprofit organization that is based in the Philippines, and they work to provide a lot of low-cost and sustainable healthcare to disadvantaged communities in the Philippines. They are partnered with a lot of different organizations, such as Stanford Medicine's CARE Center, which is the Center for Asian Health Research and Education. So for our program leads, we have our wonderful Dr. Gabiola, who is the founder of the nonprofit. She's currently a clinical professor of medicine at Stanford University, and she'll be the head of our program this year. Along with that, we have Dr. Gael, who is ABC's Chief Medical Officer, and he'll be working with us as well in the Philippines, and he will oversee our research projects and groups. So what is the program? It is a 4-week program based in the Philippines, and it includes high school students, college students, and beyond, and it helps them better understand global health and gives them more experience into the field. We do this by combining a lot of different aspects, such as workshops, lectures, and volunteer experience. What do students gain? Again, as I said, they gain a lot of volunteer experience. So generally daily, we will go to one of ABC's for Global Health medical clinics, and students can help with patient registration, vitals, interviews, EMR scribing, and the pharmacy section. Students will be on rotation, and so every single day they will work in a different station. As ABCs for Global Health is a nonprofit organization, students are eligible to earn over 150 community service hours for their time here. So, of course, we hope that you are more focused on making an impact. Along with that, we also have a lot of medical shadowing opportunities. One of the rotations on the clinic is shadowing a physician. And so as the physician speaks to the patient and diagnoses them, the student will be able to watch and ask questions. As well as that, we also have opportunities to shadow minor surgeries. Along with that, we also have a lot of workshops that teach medical skills, for example, taking vitals, such as blood sugar, blood pressure, and these are important as it will allow you to effectively volunteer at the clinics. Along with that, we also have education on handling medical records using electronic medical records as well as paper ones, and so it can help prepare students better for a job in the field. My favorite part about the program is the research groups, and so there will be a lot of college-led researchers there, and so you as high schoolers will be placed in one of their research groups, and throughout the course of the entire month, you will work on research with them. For me, last year when I went on a trip, my research mentor was a student from Cornell, and he was researching about nutritional literacy, and it's linked to cardiovascular disease. And so for that, we did a lot of data collection and data input, as well as data analysis, and it was a really cool and new experience for me, as it was something that I always wanted to do in high school. However, it was really difficult for me to find opportunities to do so. After that, there's a lot of networking and meeting a lot of new people. So in the Philippines, I was able to meet so many medical students, as well as I was able to meet the US college students who worked on research projects, as well as other high schoolers. And it's like a very new and different experience to be surrounded by so many hardworking people, and I was so grateful that I was able to meet all these people, as I feel like where I am right now, it's a little bit more difficult to meet so many high achieving people. And on top of that is life skills. As you're spending a month away from your family and surrounded by friends and mentors, you are kind of forced to be more independent, which I really enjoyed, and I was definitely able to learn a lot from. You can learn a lot of independence, leadership, as well as time management. Okay, let's go through a typical day. So from morning to around afternoon, we'll be volunteering in an ABC's clinic. So there are 18 clinics that ABCs manages. And so we will go to one of these clinics and, again, as I said, do our clinical rotations. And so we do patient registration, vitals, shadowing, pharmacy, etc. As well as on top of this, if you're in a research group that is collecting research data at a clinic, you can also work on research during the clinic. After that, we'll have what's called a feedback meeting. And so we'll discuss challenges and lessons from the day, as well as update on research. We have a lot of time to rest, eat food, and recover. And after that, generally in the evening, you can have an informal meeting with your research group and work on data organization, insight analysis, whatever needs to be done. Additionally on certain days, we will go to an indigenous community called the Ayeda people, who are indigenous to the Philippines. They are unfortunately they have very little research done on them, and so a lot of the college students will choose to do their research projects on these people and able to better contribute to their health. Okay, so my favorite part, again, is the weekend / non-clinic days. Of course, I loved gaining skills, but I also really enjoyed traveling with friends. And so we were able to explore a lot of parts in the Philippines. Of course, we are chaperoned, and ABCs make sure that we are all safe and taken care of. However, we're able to travel a lot and see a lot. For example, here we went to Baguio, and we were able to go through like botanical gardens. There is a lot of places nearby to have fun and hang out at. For example, playing basketball, or going to the pool, or going island hopping. Let's go on to some logistics. So the trip dates would be June 12th to July 12th. For price, it can vary a little bit. We'll have board, lodging, and food. We often get asked where we're staying. We get to stay in Dr. Gaviola's personal property. She has separate buildings for men's and women's dorm. As well as food, every single day students will receive 3 home-cooked and delicious meals from our wonderful cooking staff, as well as they have a lot of fresh fruits and snacks. And then flight, it depends on booking date, but you can expect the cost to be around 1,500. And on top of that, we have a few miscellaneous things that will probably cost around $250. This is just for work uniforms, for transportation. All the transportation will be done in ABC's owned or authorized vehicles, so you don't have to worry a lot about safety. And they will be driven by ABC staff, so everything is safe. We get a lot of independence and autonomy. However, I do really like that ABC's make sure that we are safe, even in like a totally different country where a lot of us are unfamiliar with the landscape. Okay, that is it for my presentation. Thank you so much for listening. You can scan the QR code here to apply, or there will likely be a link either in the caption or somewhere nearby that you can go through. Our applications close on November 24th of 2025, and so I hope to see you in our application pool this year. So application might be a little bit competitive. I believe that you can do it. It's very cliche to say, but we are looking for passionate and genuine people who want to join the program. So thank you so much. I hope you apply. If you have any questions, you can email friendsforthephilippines@gmail.com. And yes, that is all for today. Thank you so much.